billahi minash shaitanir rajim. I start the CME in the name of Allah, who is most merciful and beneficial. And we have a blessed, always His blessing on us. The CME update is a brief review of a very important topic, which is known as Lupus Anti-coagulant. It's a condition which has some clinical features and some laboratory findings. In this, it is associated with hypertension, pulmonary hypertension, epilepsy, leg ulceration, and vascular problems. It is associated in the first degree. It is not associated with connective tissue disease, and if it is associated with secondary to the connective tissue diseases, then it is known as lupus anticoagulant, and it has got antibodies like IgG, IgM, anticardiolipin antibodies, which are basically against the phospholipid component of the cell wall. And what are the clinical criteria? These includes the first and early and late miscarriage, less than 10 weeks, recurrent miscarriages, IUD and IUGR greater than 10 weeks, and first preterm delivery after before 34 weeks, and then we can have these maternal effects we can have. And we have got lab findings which are basically anticardiolipin antibodies, IgG, IgM, and which we diagnose and consider after 2 weeks apart of the samples. And also we have lupus anticoagulant, which is also against the cell wall, and these are also 2 weeks apart. So these two criteria, lupus anticoagulant of lab diagnosis and anticardiolipin antibodies, which are also diagnosed after a gap of 2 weeks apart. Maternal effect includes preeclampsia and abruption, and also there is previous history of bad obstetric history. So with this, the risk can be calculated, and the other fetal risk are the early and late miscarriages, and then IUGR, IUD, and early and late miscarriages. And then we can manage them with a good multidisciplinary team, monitoring them as in high-risk pregnancies with uterine, umbilical, and cerebral arteries, color Doppler, good drug therapy, and time, best possible time, predicting best possible time of delivery. And in this case, we have to consider with the anesthetist, as the patient is on prophylactic and therapeutic dose of heparin and aspirin. So we have to, these are any local is contraindicated, local epidural or all these regional anesthesia is contraindicated. 12 hours of prophylactic dose and 24 hours of the therapeutic dose, and they have the increased incidence of abruption and preeclampsia. What are the recommendation for the lupus anticoagulant? If there is no miscarriages and then no treatment, or treatment with aspirin alone, previous history of thrombosis with heparin and aspirin, previous history of IUD, IUGR, and early and late recurrent losses, then aspirin and heparin. So with this, all these a takeaway baby home rate aspirin 40%, 7% with heparin. Some studies they dispute this outcome, and we have to follow this with the uterine, umbilical and cerebral arteries Doppler at 24. If they are normal, then we can stop heparin. So lupus anticoagulant is immune disease, and it's a lupus anticoagulant, which is basically anti-cardiolipin antibodies and lupus anticoagulant against the phospholipid component of the cell wall. We will review in another one. The component is SLE, systemic lupus erythematosus. So takeaway message is pray, praise, trust, love Allah, worship Allah, and follow the lifestyle of Hazrat Muhammad sallallahu alaihi wasallam, which is our health and our survival. Allahumma ajirna min nar, Allah save us from the fire of Jahannam. And Subhanallah wa bihamdihi Subhanallah al-Azim. And we must not follow our the glorious path दो नीम उनकी ठोकर से सहरा और दरिया सिमट कर पहाड़ इनकी हैबत से रहा, and always follow Allah. हम तो माइल बकरम है को साहिल ही, राह किसी दिखलाएं को रहबर मंजिल ही नहीं. Inshallah will come with another review, CME update by Mother and Child Survival Group of Pakistan, a group committed to and dedicated to reducing the mother and child mortality and morbidity by antenatals. Thank you very much. Jazakallah. Ama alayna